and passion.
Hi, Jamie. I'll be your nurse today. How are you feeling? What brought you
Poop.
What brought you in here today?
Well, my doctor wanted me to come in because I've been having lots of muscle spasms and I've been trying to walk, and it makes me not want to walk.
And I see you also have the diagnosis of multiple sclerosis. How's that
Yes.
being treated?
I have been diagnosed with multiple sclerosis.
Are you treating it with any medications?
No,
Are you on any other medications currently?
no.
All right. Well, I think that the doctor's talking about Baclofen. Did he say anything about that to you?
He just told me that's what I should be on.
And that's used to treat your muscle spasms, and it helps relax those muscles a little bit. So it'll make it easier to walk and as you like to do dance.
I do. I want to dance like Michael Jackson.
And I think one of the doses he was talking about would be about a 5 milligram dose 3 times a day, just to start you out. And if it needs to be increased, then we can do up to 80 milligrams a day.
Wow.
So if that...
Can we just go ahead and give me 80?
Actually, we're just going to start with the small dose because sometimes the smaller dose works for people. It's up to the doctor to see how everything's going. You'll probably come back in about a month or so to see how your progression is. And if it's not helping at all, then you can call the clinic and make another appointment.
Oh, okay. I hope it works.
Do you have any other questions?
What are the side effects?
Some of the side effects that you could have are dizziness, weakness, fatigue. You can get a blurred vision, nausea and vomiting, and sometimes chest pain. But that doesn't mean you'll have them. That's just common side effects that may occur.
Okay. What if I forget a dose?
If you forget a dose, I would say that you need to wait till your next dose if it's close enough. If it's close enough to the time you forgot, then I'd take it. But if it's close to the next dose, you just take your next dose and skip that dose. So you don't want to double dose because that could cause drowsiness and even some more issues there. And you can take it with or without food. It doesn't matter. It's not going to tear up your stomach too bad. If you do feel nauseated, vomiting, after you take it without food, you can start taking it with food. That might help with your stomach issues. Are there any other questions?
No.
All right. Well, I'll get you up and back dancing soon.
I can dance now. That's enough.
What can I help you with? I noticed your collar was going off.
Hi, yeah, I'm going into surgery soon, and I just had a couple of questions before I go in.
What can I answer?
What does this surgery exactly do again? Can you explain
We're going to
that?
be putting a Baclofen pump into you, and it's about this big. It's about a hockey puck. It's going to go into your stomach, and a little tube will go from the pump into your spine where you had that injury, and it is going to release the medication straight into your spine because your oral medication isn't working that well.
Okay. Well, my legs, will I be able to walk when this is done?
Your leg mobility should increase, and the doctor actually wanted me to assess your leg mobility prior to the surgery, so I'm going to lift these covers and we can do that now, okay?
Okay.
So we're just going to do some range of motion here, and we're going to try and bend your knees, okay? Okay, and now we're going to try and bend your other knee. And then we're going to try and straighten it out. All right, we'll try and straighten this one out now. All right, and that shaking is supposed to go away when you get your Baclofen pump put in.
Okay.
Do you have any other questions about the surgery that you're about to have?
What kind of side effects go along with this surgery, or this pump that's going in?
Well, the side effects you could have a little bit of dizziness, some weakness. You might have a little bit of chest pain. You could have some blurred vision, or some nausea and vomiting.
Okay. How much do I have to, like, will the doctors infuse this, or like when I go home, how will I have to infuse that, or how much?
The pump has a set amount inside of it, and it will last for a certain amount of time. And when you do need to refill the pump, what we can do is we can insert a needle into that little hockey puck that I was describing before. They can take out whatever's left in there and reinsert a new set of medication in there so it can last you for longer. Does that make sense?
Yeah.
Okay. Do you have any other questions prior to the surgery?
So is it a high dosage? I'm not sure.
It's going to be a lot smaller dosage than the oral medication you're taking because it is going to go straight into your spine. We're probably going to start you off with about 50 micrograms per milliliter versus your oral medications that you're taking. So it is a lot smaller dose, but it's a lot more effective when it goes straight into your spine.
And what if does that need to increase ever?
It'll increase slowly if it needs to be. You'll have to come in for other checkups so we can assess your mobility after you've had the pump put in.
Okay. Thank you.
Good morning. How did your surgery go the other day?
Hi, I think it went pretty well.
Okay. Do you have any questions about your pump now?
Yeah, could you just go over the doses with me one more time?
Okay, the doses, you're going to have 3 separate bolus doses, and what that means is it's just going to be a lot at one time, and they're going to be 24 hours apart, and the most you could get would be 100 micrograms, and that, again, is just going to go straight from that little hockey puck into that tube into your spine. And there'll be three separate doses, like I said, over 24 hours.
Okay, sounds great.
Okay, well, let's look at your mobility here, okay?
Okay.
And hopefully this should have improved from that shaking that you had prior.
Oh yeah,
So this should...
definitely.
I see that your mobility has improved a lot. So the surgery did go well, and you're gonna have to come in for other checkups just to make sure that it keeps improving and to any changes of your dose, okay?
Okay, thank you. I am so happy.
Okay.
Cut!
Additionally, some precautions with Baclofen are pregnancy and breastfeeding, use of geriatric patients, peptic ulcer disease, renal and liver disease, strokes, seizures, and diabetes.
Some assessments to be aware of are avoid alcohol while on this medication, avoid hazardous activity until you know how the medication works, do not take with an antihistamine because it can interfere with this drug, notify your doctor if painful urination occurs, nausea is persistent, headache, tinnitus, insomnia, and confusion occur. It may take 1 to 2 months for full response to occur.
And also be mindful that hallucinations may occur. Cut.
With overdose.
With overdose.